More than 400,000. That's how many Americans are testing positive for COVID-19 every single day. The surge after the Christmas weekend has shattered all expectations.
And this includes a spike in the number of children infected, just as millions of them are returning to schools. Our health reporter Lori Johnson brings us the latest on this raging pandemic.
Johns Hopkins reports more than 1 million new cases were recorded Monday. The massive spike due to the rapid spread of Omicron, combined with a backlog of cases not reported over the holiday weekend. Right now, more than 400,000 Americans are testing positive for COVID-19 every day. That's a 200% increase since before Christmas, a new record high that health experts predict will get worse before it gets better. Currently, more than 100,000 Americans are hospitalized with the virus, up 130% from 2 months ago. The peak was 137,000 set last January. Right now, 17%, or roughly 18,000 of those hospitalized, are in the ICU. But deaths, which are a lagging indicator, are down about 3% since 2 weeks ago. However, there is a new trend. Children's hospitalizations up 66% over the week before. 378 admitted last week, which the CDC says is a new pandemic record. One of those youngsters, Sarah Barlow's 2-year-old daughter.
The high fevers came in waves. It can get bad. It's not just a simple cold for everybody.
The FDA authorized booster shots for 12 to 15-year-olds, just as most kids head back to the classroom despite the surge in cases.
There's a lot schools can do to keep infection numbers lower, improve ventilation, have kids and adults masking, vaccinate everybody who's eligible.
Some school districts like Atlanta, Milwaukee, and Newark going back to distance learning, hopefully just this week.
Superintendents today are getting phone calls learning that some of their schools may have 5 to 10% of their staff not available due to COVID-19.
This Friday, the United States Supreme Court will hold a special hearing to consider the legality of 2 Biden administration vaccine mandates, one for certain healthcare workers and the other directed at businesses with 100 or more employees. That would affect 84 million workers, Gordon.
Tell us about the Supreme Court case. What's the issue with the vaccine mandates?
Well, it's important for our viewers to understand, because a lot of people are worried about this. A couple of things. Number one or both of these mandates could be struck down and they could be blocked. A lot of legal experts are expecting that. But if they are upheld, it's important to understand that the workers who work for these larger companies, they do not have to get a vaccine if they don't want one, because there is a testing option. A lot of people don't realize that. If you work for one of these companies and the mandate is upheld, all you have to do is tell your employer, I don't want a vaccine, and I will submit to the weekly tests. Now, granted, that's a little bit onerous. It's a little bit of a pain. It's annoying, and it could even be expensive for people to do these tests every week. And they also have to mask at work, but they don't have to get a vaccine if they don't want to. Now, the other mandate for the certain healthcare workers, these are people who work for healthcare agencies that are funded by Medicare and Medicaid. So that's tens of thousands of people, 80,000 people roughly work for these places like nursing homes, and there is no testing option. There's no testing option. So these people have to get a vaccine unless they have a religious or medical exemption.
All right, well, tell us about the CDC. They've now reduced the quarantine period to just 5 days if you've been exposed but you're asymptomatic. Are they getting any pushback on that change?
They really are getting a lot of pushback, Gordon, because a lot of health experts are saying, wait a second, 5 days, you could still have it. You could still be contagious. And so they think that it's wise after 5 days of quarantine, not 10 like before. That was a bit much. But after 5 days of quarantine, you should at the very least have a negative test. And so it's very likely that the CDC will revise its guidance this week and say that people do need to test after that 5 days. They have to have a negative test before they can re-enter society, go back to work and whatnot. The only problem is, of course, those tests are very hard to find. I don't know if you've tried to find one. I have. I've scoured all the drugstores in this area, not one home test to be found. And the lines for the PCR tests, those are often hours long.
Well, Catherine got us stocked up right before Christmas, so we're good to go for a couple of months. And it's great when you get the negative result back. It really does help your mental state. Let's talk about the differences in the various variations where you have Omicron that's supposedly less deadly than Delta. So what's the breakdown of the current caseload, Delta versus Omicron?
Well, nationwide, the CDC said 5 days ago that Omicron made up 58% of the cases and Delta made up 42%. That was different from what they originally said. Earlier, they said 72% of the cases were Omicron. Then they revised that and got more data. So we're still dealing, and that's nationwide. So in certain areas, it could vary. So we're still dealing with the 60-40, maybe 50-50 split. And as you pointed out, Gordon, the Delta variant is much more virulent. We're seeing much more severe cases in people who have Delta.
All right. Is there any hope here? I mean, it looks like we're going from variant to variant. Do you see any light at the end of the tunnel? You know, assuming people get vaccinated, get the boosters, get whatever they need. Are we going to see an end to COVID? Are we going to see herd immunity? What's your prediction?
Well, a lot of health experts didn't even predict Omicron. Some of them were saying Delta was going to be the last wave and then it would be pretty much an endemic. Most health experts are saying that coronavirus is not going to go away ever. It's probably going to be endemic, sort of like the flu, where we get a shot every year. And some cases in people who are high risk could be deadly. But for other people who, especially those who have been vaccinated or have some level of immunity, it's not going to be as virulent. So that's what a lot of the health experts are saying. But, you know, they've been wrong before. A lot of people thought, you know, at the beginning of this summer, it was gone for good when we saw the cases and the deaths go way down. And then it came roaring back, as you know.
All right. I guess I should encourage China to stop investigating bat viruses. It might be good for all of us to leave them in the cave. Lori, thanks for the report and thanks for the update.